I think we can start. People are still joining, but let's get on with it.
Okay. Hello, everyone. Welcome to our Q&A session. My name is Paula Francekovic, and I have Sophia with me. And my role is I'm a glycanage specialist. So I've been working for more than 2 years, helping glycanage clients interpreting the complex science behind the glycanage report and help them be on their way to achieve a healthy longevity. And Sophia, you may know her. She is our partner manager, so she knows how to deal with your questions and how to answer all of your questions and concerns. So hopefully this will be a very informative session for you today. Just to recap from our discussion last time, we went through the new version of the practitioner's report. I will just quickly share my screen and share with you some main points. Hopefully they will inspire you for more questions. After we go through this introduction, I will answer some of the questions that were left unanswered from the session before, and then we will move on to your fresh questions from today. So here we have an overall glycanage report for medical professionals. So generally in glycanage, we are focused on measuring immune system health. We believe that optimizing the immune system health is one of the major pillars in achieving a healthy longevity, because without a functioning immune system, none of the other things can go quite right. And we are at a high risk of developing an array of chronic diseases and conditions. So we do this by looking at the glycan structures. So glycans are complex sugars and they are present all around the body, but we also have them on our immune system cells. Glycans respond to aging and they respond to inflammation. So they are very nice indicators of potential negative influences of inflammation on the aging process. So this is overall called inflammaging. We also have other parts of the new report. So we have executive summary where you get your overall results summary and glycan insights. We have the results breakdown where you will see your biological age changing over time and you get deeper insight into all of the glycan indexes. So you can precisely see what is your, for example, anti-inflammatory glycan levels. Are you a good responder? Do you have a high level of protective glycans capable of fighting off different intruders? Or you can also evaluate if you have, for example, a higher pro-inflammatory load and get these indexes are very information rich, so we can find out many things from them. We also have glycan insights, so we know that certain diseases tend to have a distinct glycopatterns, and we overlap the results of your clients or partners with these diseases. We can see if the sample is overlapping and if there are some indications that resemble early development of these diseases and conditions. And we also have the newest edition of the report, and this is the influencing factors. So those are not diseases, those are kind of stages of life or certain therapies or medications that may influence the glycanage results in a positive or a negative way. So I'm quite excited about this part of the report. So just brief walkthrough again. This is an executive summary, and then you have a results summary at a glance. I really like this because it gives you an opportunity to recognize the patterns. So oftentimes we, for example, see lower levels of glycan youth at the same time when we see higher levels of glycan mature. So here is a nice overview to allow you to see the patterns right away. We also have a nice overview of the glycan insights. So you can right away see if there are some areas that need your further attention and could help you create actionable steps. Yeah, and then we have the results breakdown. We have the factors that influence, that could lower the biological age or increase the biological age. We have this portion of biological age over time, which is very exciting. You can actually see, for example, when your patient starts to implement protocols that you recommend or therapies that you recommend, how the biological age changes over time. Is it increasing, decreasing? Is the protocol beneficial for that patient? We also have the breakdown of each of the indexes depicted in a really nice way. And we also have suggestions on what areas to look for and how to go about to optimize that index if the result is disrupted. Then we have the glycan fingerprint portion of the report, where we have the diseases overlaps. So you have a nice representation of how to interpret each part of the overlap. Yeah, I will not lose time on this because each of the diseases has a distinct pattern that needs to be looked at individually. You also have a list of related research papers that we use to form these overlaps, which are for the ones that want to learn more and discover how we created these overlaps in the first place. And then we have the influencing factors. Of course, we also listed the interventions, and we provided a summary of the key findings here for your convenience. And we, for example, know that in pregnancy, the overall biological age decreases, and glycan shield and glycan youth tend to increase quite dramatically. So pregnancy is a positive influencer of the overall glycan age result. Post-pregnancy, we see quite a different picture. We also have some other indicators, for example, irregular cycle, perimenopause, hormone replacement therapies, and we will talk about most of them today because most of your questions are actually related to these areas. Okay, and then we have the list of all of the research papers that we use to create this practitioner's report. I will stop my sharing after this quick recap, and I will start with the questions from your previous session. Let me just open up the questions here. One second. So the first question was, can a chronic or acute injury, for example, soft tissue shoulder injury or bone break, impact the glycan age results? I would say these types of injuries have a chance to impact glycan age results. So what is happening is there are inflammatory responses activated by the injury, and they first and foremost can increase the level of pro-inflammatory glycan mature glycans. We call them agalactosylated glycans. In certain cases, this pro-inflammatory shift can also increase the bisecting glycans, which are part of the glycan lifestyle index. So these all occur as a consequence of the injury. So that would negatively impact the overall biological age. Also, it's very important to note that if a person that gets injured before the injury had low levels of anti-inflammatory protective glycans, which are part of the glycan shield and glycan youth indexes, may be prone to a longer healing process because the body doesn't have, is not equipped with proper anti-inflammatory protection, which will heal the body faster. The second question is there any advice for managing rheumatoid arthritis? For managing rheumatoid arthritis, so rheumatoid arthritis is an overall inflammatory disease. So most important focus would be to reduce systematic inflammation. Very interesting about rheumatoid arthritis and the way that we observe this in glycan age is what we strive to do with the diseases overlap is actually determine people that are in a higher risk of developing rheumatoid arthritis in the future. And we know this because there are studies published by our lab that show that glycopatterns can change even 10 years before the rheumatoid arthritis diagnosis. So what we want to do is actually look for people that have the glycopattern indicating that they may be at a high risk of developing rheumatoid arthritis, and combine this with other metrics, for example, their family history, or for example, rheumatoid factor levels or other metrics, to find out who is at a high risk category. So I would say answer to this question has a dual response. So if your patient already has rheumatoid arthritis, there are, of course, disease-modifying anti-rheumatic drugs that this patient can take, or, for example, new biologics that are constantly being improved and developed. And if this is the case, you can use glycanage as a way to evaluate the positive effects of those therapies. We know that biologic therapies are new and still not perfect. They help a lot of people. However, we do have a certain group that are non-responders to those therapies. So it would be very interesting to see in those, are the glycopatterns still remaining inflammatory and resembling rheumatoid arthritis, or are there any changes? So you can use the glycanage to evaluate the beneficial effects of the anti-rheumatic therapies. In people who are at a high risk of developing rheumatoid arthritis based on their glycoprofile and based on family history and other factors, we can implement anti-inflammatory preventative protocols that mostly revolve around lifestyle optimization, primarily implementing anti-inflammatory diet rich in, for example, omega-3 fatty acids or curcumin or antioxidants that can reduce the pro-inflammatory load, and also combine this with regular physical activity, stress management, adequate sleep, which are all kind of very important pillars when we are thinking about this preventatory stage of rheumatoid arthritis prevention. I have to mention here that typical patterns that we see in rheumatoid arthritis prone patients are, so they would typically have at the same time high levels of glycan mature and low levels of glycan median, shield, and youth. So if this is present in a combination of family history or certain very early symptoms, for example, some joint pains, then you can implement those preventative protocols and monitor the patterns over a few months. And if you see, for example, what would we typically see is increases in the glycan median and consequence increases in the glycan youth and decreases in the glycan mature. Those would be early indicators that this protocol is working in a beneficial way for your patient. And in the overlaps, this will be depicted as going from significantly overlapped to minorly overlapped to hopefully not overlapped whatsoever. So very interesting application of the glycanage that can be done with these early indications of different diseases. The second question is, can you repeat the information about the effects of testosterone therapy in men on glycanage result? So based on our study so far, we know that testosterone replacement therapy in patients that need the testosterone replacement therapy show beneficial results. So overall, we see improvement in the biological age, and we see a steep decrease in the agalactosylated pro-inflammatory glycans that are part of the glycan median index. So very beneficial results. We also, what is very interesting is what we noticed is that testosterone is not the primary driver of this beneficial improvement in glycanage. It is actually, so for example, one part of the population in the study took aromatase inhibitors as well, which inhibits testosterone conversion to estrogen, estradiol. So if aromatase inhibitors are present, we wouldn't see these beneficial effects. So it is actually the endpoint estrogen that is driving the positive influences, positive changes in the glycom in both men and women. So yes, testosterone replacement therapy is beneficial, but without blocking the conversion to estrogen. Second question is about coenzyme Q10 supplementation and its impact on glycanage result. I have to say that there is a limited data available on the precise impact of CoQ10 supplementation on glycan age results. We know that all of the efforts that act in an anti-inflammatory way or antioxidative way tend to correlate with reduced inflammation, which could beneficially influence the glycan age results. However, I have to say that pyramid of priority needs to come first. So if there is no base in the pyramid, there is no reason for us to think about supplements. So for example, I would first think about optimizing the caloric intake, introducing regular daily movement patterns, optimizing the morning and evening routine to optimize sleep, and of course, implement very easy, manageable stress management tactics. If this is implemented, then we could potentially think about adding these different supplements in order to provide additional benefits, additional protection. But if the base is not there, they would just fall off and the whole pyramid would crumble into pieces. So I would say coenzyme Q10 may have additional benefits, but it's just one puzzle piece. Typically, what we found is that quick fixes do not influence the biological age in a severe amount, a beneficial amount. There is also one question about hormone replacement therapy alternatives for those intolerant to estrogen. This is a very interesting topic, and I have a few disclaimers before I answer these questions. So first of all, it's important to know that we do not prescribe hormone replacement therapy. This needs to be done by hormone specialists who is going to produce some other genetic tests, hormonal tests to confirm if a client is the right candidate for hormone replacement therapy. So in glycan age, what we can see is an indication. So for example, we know that the glycan patterns change in a predictable way in perimenopause. So we can say that a person may be a good candidate for hormone replacement therapy, but further investigation by a hormone specialist is needed. So glycan age here can be used to really titrate the dose and the mode of application of hormone replacement therapy. So we know that, for example, some women tend to respond better to having estrogen in forms of gels or patches rather than having it in oral form. And we also see this depicted in the results. So typically they would reduce their biological age more if the mode of and the dose of application is adjusted and personalized to them. If a person is evaluated as not a good candidate for hormone replacement therapy, they can look for other options. I would recommend lifestyle modifications first, so making sure that the base of the pyramid is there. And we also know, so for example, what I would suggest here is working with a medical herbalist, because we do have some herbal supplements that can truly ease this transition. It could even act as weak estrogen themselves. So we have some phytoestrogen and isoflavones coming from the diet or coming from herbal supplements that can truly help with the symptoms and truly help with, for example, increasing the bone density, improving collagen in the skin, and also provide some of the protective benefits we get from hormone replacement therapies. I really like, in my practice, working with black cosh. It's called simicifuga in Latin, and I sometimes combine it with valerian root, and it seems to work. A lot of women report feeling much better when they have those two things combined. So their night sweats reduce, their anxiety reduces, and they overall feel a lot better. So there are some I would say alternatives, but in generally hormone replacement therapy works at a very systematic level. So if you are a good candidate, it's worth considering and following up with the hormone specialist. And I have to say one important disclaimer here or advice. I would say patience is key. If you are not a good candidate for hormone replacement therapies, I would say it gets better So we know that we have a certain part of our client base, which are women in postmenopause, and they are still able to have a biological age that is 10 years lower than their chronological age, for example, even without hormone replacement therapy. So, but I would say in most of those cases, lifestyle is on point and fully optimized. The second question is about, so I will read it through. In biological age reversal, are the markers that change galactose and sialic acid on IgGs, so immunoglobulin molecules? So yes, galactose and sialic acid are the beneficial ending molecules on our glycans, and they have anti-inflammatory effects. So if a person is going to reduce their biological age, what will actually happen is they are going to increase the level of galactosylated and sialated glycans. And they act in a very anti-inflammatory protective way. So typically people with, for example, very high levels of sialated glycans tend to have high level of resilience in their immune system, and they are less prone to, for example, developing seasonal colds, and they just have an overall very robust immune system. Second question is regarding NAD+ supplementation. A partner is asking, can you show us or tell us where to find our small study? So as you may know, we recently did the NAD+ supplementation study with a company called Nuchido Time. I will put a link to the study in the chat. There was an overall mild, so there were two groups of participants. There was an intervention group and a control group. So we see a mild improvement in the overall biological age in the intervention group. So people who took NAD+ supplements for 28 days. We see 1.26 years reduction in the overall biological age, and we didn't see this in control group. Let me just put it in the chat. Yes, and I will also here use the opportunity to remind you that we also have our research matrix. So this is a really nice page that allows you to filter all of our studies done by our team by the area that you want to look into. Okay, second question is, does a high dose of peroral glucans, beta-glucan or others, affect test results? This is a very interesting question. So I know that there are some familiarities between the words glucans and glycans. Just to make it clear, they are completely different. So glycans are sugars that our body makes. It's a very, the body makes it, and the body has a very complex mechanism behind putting these glycans on top of the proteins, on top of the immune system molecules. It's strictly enzymatically controlled. There are lots of enzymes involved in that process. And glycans are made from simple sugar building blocks. So the body knows what building blocks it needs to produce these kind of human-specific glycans. Whereas glucans, like beta-glucans, are natural polysaccharides that are used as, I would say, food for our microbiome bacteria. And when they are metabolized, they create short-chain fatty acids in our big intestine, which can be used as energy by our colon cells, but they can also stimulate our immune system responses. So in that way, short-chain fatty acids that are being created by the ingestion of beta-glucans can stimulate some of the anti-inflammatory benefits and could potentially increase the levels of glycan shield glycans, I would say, first and foremost. However, unfortunately, this study was not done yet, but it's a very interesting subject. Okay, the second question is, does finasteride or dutasteride affect the glycan age result? So just to make it clear, those are medications used to either treat benign prostate hyperplasia or hair loss. So if they are used to treat benign prostate hyperplasia, they are typically used at a dose around 500 milligrams per day. if they are used to treat hair loss, they are typically used at a much lower dose of 1 milligram per day. And the medication is called Propecia if those finasteride and dutasteride are used for hair loss. Very interesting is the mechanism of action behind these two medications. So basically, what they do is they block conversion of testosterone to a DHT. And one would think if this conversion is blocked, then we would have higher levels of testosterone, therefore beneficially impacting the glycan age results. However, this is not the case in practice. For example, we recently had 3 male clients that were taking Propecia for hair loss. All 3 had elevated biological ages, spanning to 1 year elevation, 4 years elevation, and a whopping 34-year elevation in biological age. These men showed similar patterns. So all of them showed reduction in glycan youth, modest increase in glycan mature, and decrease in glycan median levels. The levels of glycan lifestyle and shield varied. So it's interesting that glycan youth and glycan mature indexes are the ones that are that typically tie into sex hormone levels. And I have to mention here quite a controversial topic that has to do with finasteride use, and that is the post-finasteride syndrome, which I'm not sure if it's recognized as the real medical syndrome, but some men experience persistent sexual, neurological, and physical side effects of taking finasteride. And it's very interesting that one subset of the population experiences these symptoms, which unfortunately in some cases can be permanent. And typically men that take finasteride for hair loss are in their 20s, which is something that we should know. And we should not administrate finasteride for everybody that wants to keep their hair. And we, for example, I see a great application of glycan age testing here. For example, suppose a hypothesis is, what if, for example, people that prior to taking finasteride have an overall steep increase of the biological age, which makes them prone to developing this syndrome? Or, for example, are the ones that are started to take finasteride, are they more prone to increase pro-inflammatory glycans and increase their biological age in a much higher level than the non-responders, the people that do not develop this post-finasteride syndrome? So this is something to be aware of and taken and recommended with caution, I would say. Okay, I'm trying to find the next question. The next question is, will the recommendation section be listed on the new report as shown during the presentation? So the answer is yes. So the report is going to look the same as I presented to you. So I used kind of the real report that is going to be used in practice. And then we have 2 questions related to dietary interventions and their connection with glycan age results. So the first question is there a difference between a caloric restriction diet with or without carbs on the glycan shield index? And the second question is just a comment that correlation with diet is too general. And is there any data related to specific food groups, for example, dairy products, or the antioxidative capacity of the diet? We have to say that we did a limited number of studies regarding the dietary influences of related to glycan age results. So we evaluated people on different types of diets. So we had groups of people that were on high protein, low glycemic index diets, low protein, high glycemic index diets, and all of the combinations with the control groups, of course. So they were on the intervention period, so they ate only 800 kilocalories per day, and then they were on maintenance periods where they implemented these different types of diets. So what we found is that overall glycan markers improved when they were on the weight loss period, so showing that caloric deficit is extremely beneficial for improving the overall glycan age result. But when they were on the maintenance period, we saw that some people had improvements in the results, some people even worsened their result. So what we concluded is that it needs to be approached in a very individualistic way. And we have a few set points here, because we work with a lot of clinicians, a lot of practitioners, that I would say each of you has a different view on diet and how diet interventions are supposed to look like. So rather than us telling to you what dietary protocols you need to implement, it's very interesting to kind of combine. For example, if you have an idea on what works, for example, in your specific groups of patients that you are seeing, and then using glycan age results as a marker of success. Because overall, we want to see improvements in the glycan age, reduction of the pro-inflammatory side of glycans, increase in the anti-inflammatory glycans, and that should be a marker of success that this dietary regime is working in a beneficial way. I also have to mention here that we sometimes are limited by, for example, manpower or financial resources that we need to conduct dietary-related studies in-house. So oftentimes we rely on dietary studies and samples provided by, for example, research institutes. And their dietary quality is going to translate to our interpretation as well. And you know that nutrition studies are notoriously bad for as a field of study. There are just a few institutions in the world that conduct nutrition studies in a proper way, and they typically take a lot of years to develop. So all of the things need to be combined. We need to be in contact with these institutions. We need to have all of the factors ready, and the study design needs to be set up in a proper way for us to have indications of dietary types and details of the diet. So I would say, hopefully in the future this is coming, but for now, we would very much like to collaborate with you and, for example, see what dietary protocols are you using in practice, and can we use glycan age to evaluate the benefits of such dietary protocols on your set of clients and patients. Okay, I think those are all of the questions from the last time. While I was talking, I see a lot of questions were generated. So Sophia, I will let you take over a little bit, because I'm quite out of the chat information.
Yeah, absolutely. So thank you, Paula. This was very helpful, and hopefully for people who were present at the last webinar, we managed to answer all of the questions. We got a couple of new ones, but I would definitely encourage everyone to leave us more questions, because this is a Q&A session and we're really here for you to answer either questions related to the newest report or really anything else regarding your partnership with glycan age. We know that most of you are partners with us, so we're here to help you out, integrate this into your practice and understand as much as possible about it. So the first question we got, and this is one that we very oftenly actually get, and this is how often this should be tested. This, I assume, how often you should do your glycan age test. So the easy answer, the straightforward answer, is that we would recommend retesting your glycan age every 3 to 6 months. Just because with most interventions, this is the time frame where we can expect to see meaningful results. The scientific background for it is because we measure glycans on the immunoglobulin G, which has a half-life of about 21 days. So just to be on the safe side, we would recommend that you retest 3 to 6 months, every 3 to 6 months. Now, it really depends on the intervention itself, how quickly you would see results, and also how big of a change you would be seeing. But again, to make a very long story short, we would be recommending to retest your glycanage every 3 to 6 months. The next question, I think, Paula, this one is for you. So the question from Camelia is, what is the impact of taurine and glycine supplementation on glycation? Maybe we can address this confusion that also arises, glycation versus glycosylation, but Paula, I will let you take over this one.
I think you actually have a really nice explanation of this difference, because I always fumble with words describing the difference between glycation and glycosylation. I think you've done a really good job explaining this prior, so would you mind explaining it again?
Yeah, absolutely. And then I'll let you take over the impact of taurine on it. So again, this is something, just because of semantics, it sounds very, very similar, glycation and glycosylation. And this is something that we hear all the time. So just to clear it up, glycation is a process that happens within or inside of our blood. And the process itself is the addition of glucose molecules onto different proteins. Now, when you hear this explanation, it sounds very much like glycosylation. So let me just explain this a bit further. So usually we talk about glycation in the context of insulin resistance and diabetes. So for example, we would be looking at glycated hemoglobin as one of the metrics that is used to monitor how well your patient keeps control of their glucose levels. So if somebody has a high percentage of glycated hemoglobin, we know that they struggle with controlling their glucose levels, right? This process, it is random, it is non-regulated by our enzymes, and this is essentially just the addition of simple glucose molecules onto the different proteins in our blood. Now, that is glycation. On the other side, we have glycosylation, and I think Paula already kind of gave us a good introduction into what glycans are, but just to look at it from a perspective of how does this process happen, it actually happens not in our blood, it happens within our cells, and it is a controlled, regulated, and most importantly, an enzymatic process. So as we know, there are many, many different factors which will impact what type of glycans will be added onto the proteins. And one key thing is that most of our proteins, actually 60% of our proteins, are designed to have this modification. So it's not a question of whether we have glycans on our proteins or we don't have glycans on our proteins, which is the case with glycation. But rather the question that we want to answer is what type of these glycans we have on our proteins. So that's kind of the distinction between two very, very similar sounding terms. So I hope that helps. And then I'll let Paula.
Yes. So I will take over, and I will actually try to answer the question on the impacts of taurine and glycine on glycosylation, not glycation. So of course, I have to say right away, our team did not develop any studies looking at those particular supplements. And these are very early days of such supplements. I see potential benefits in them. For example, particularly now that we have these diseases overlap. So taurine, to my knowledge, is used to control blood pressure and overall nervous system health. So I would say it is definitely worth a try, of course, with other lifestyle adjustments, particularly in people who have overlaps in the pre-hypertension and hypertension stages, because we still, a lot of people ask us, okay, I'm prone to develop hypertension due to my glycoprofile patterns, but what do I actually do? So we still do not have the gold standard protocol. So we are always trying to find lifestyle modifications, further supplement recommendations that would work in this subset of our clients. So I would say taurine is one of the main candidates that we would look into and see if this overlap with pre-hypertension and hypertension can be reduced, of course, with lifestyle adjustments in a combination with taurine supplement. For glycine supplementation, it's also a very interesting, I would say, emerging topic, because when we talk about aging science in general, one of the proposed theories is that protein restriction could be one of the longevity interventions. This is still a very controversial subject, but there are some studies looking at, for example, particularly methionine restriction as a way to prolong lifespan. It's working in mice. In humans, we do not have enough data, but glycine would work as a competitor to a receptor to methionine. So it would kind of inhibit the negative effects of potential negative effects of methionine. So it could aid in, but it's very speculative, and most of the research is done with animals so far. And we do not have studies on humans yet, but it's a very interesting topic.
All right. Let's move on then. Thank you, Paula. So we got a comment from Kathy. In my experience, not eating ultra-processed foods on a regular basis has reduced my biological age. Congratulations, that's amazing. So that's one recommendation, I guess, that works for everyone, is reducing ultra-processed foods and trying to eat as many natural and
yes. And I would say most of the cases where we have high ultra-processed food intake are in the glycoprofile seen as elevations of particularly glycan median, so pro-inflammatory load gets higher. So addressing this would reduce the pro-inflammatory load and also improve the biological age overall. So simple lifestyle adjustments like this really go a long way.
Perfect. Okay, we have a question from Dahlia. Can medications like corticosteroids and JAK?
Yeah, JAK inhibitors, yeah.
Oral or topical?
I have to say topical corticosteroids, for example, used in atopic dermatitis or psoriasis, do not generally impact the glycan age results so much, but JAK inhibitors, this is also an under-researched subject, but JAK inhibitors specifically act in reducing particular interleukin pro-inflammatory pathways, which are, for example, overactivated in people who have atopic dermatitis or psoriasis or so on. So there is a potential here that we would see slight decreases of the biological age. However, this is not researched at all, because I think JAK inhibitors are also very new. And I don't know, Sophia, if you know of any studies that we did on this. We did a lot of studies on psoriasis and about biologics that are specific to psoriasis, but I'm not really sure if JAK inhibitors were part of the intervention.
No, unfortunately not, but we found another thing we could look into. So thank you for that. We have the next question from Marta, and we do have like 15 minutes left. So please, if you do have any questions, it doesn't, again, have to be related to the interventions. Have any practical questions on using the dashboard or even ordering test kits, just let us know. So the question from Marta is, do you measure glycosylation of total IgG, or do you also analyze any antigen-specific IgG? So we measure glycosylation of total IgG, and we do not look into any antigen-specific IgGs. However, there is a lot of studies on antigen-specific IgGs, and also how their glycosylation changes in different diseases. So that's also a very, very interesting topic. But with our test, we look at total IgG glycosylation, and that is it. All right, we'll give you some time to ask questions. Perfect. Thank you. We will be sending you the recording of this, and obviously we are always available for any of your questions, but I think this is just a great opportunity to kind of get your answers quickly. So we'll just give you some more time, and yeah. Any other supplements you can discuss? Another question from Dahlia. I think, Paula, you're the best candidate for this one.
Yes, so most of the beneficial impacts of supplements can be seen in glycan shield index. So this is the index that seems to be the most responsive to nutrient density of the diet and also supplementing with vitamins and minerals. So just from anecdotal evidence so far, working with a lot of people in practice, we know that all of the efforts that we typically use for immune boosting effects tend to increase the level of glycan shield glycans and provide this additional protection. So most of the work will be done by the classics. So vitamin D, omega-3 fatty acids, and magnesium. They do most of the bearing. And vitamin D is very interesting because we mostly associate it with bone health, but it's extremely important for immune system health as well, and also cardiovascular health. Interestingly, a majority of a population is in most of the countries is deficient in vitamin D. So definitely one of the first things that I would ask if, for example, I see somebody that has an overall lower levels of glycan shield, are they taking vitamin D? Are they taking omega-3? Are they taking magnesium? Not just in form of supplements, but generally evaluating the dietary quality and see if are they getting enough green leafy vegetables, fish on a weekly basis, fatty fish particularly. So evaluating pillars like that. And when this is optimized, we see generally elevations of the glycan shield, and we can see further elevations in certain specific cases with, for example, some antioxidative therapies. Most of the times we see it, for example, in people who struggle with thyroid issues. When they go, for example, have a combination of vitamin E and selenium, they tend to increase the glycan shield and also improve the thyroid health as they go along. So it really depends on what we are working with. But I would say the classics, the immune boosting classics, do most of the bearing most of the work.
Okay, thank you, Paula. I'm not. Oh, all right, Dalia. Can too much vitamin D cause calcification? What is a safe daily dose to keep levels at the right number? I love this question.
Yes, this is a very good question. So to combat this potential calcification, oftentimes D3 supplementation is combined with K2 supplementation. However, very interestingly, the reference ranges for optimal intake of optimal recommendations of vitamin D were created having in mind the impacts on bone health of vitamin D. And I would say these days we are kind of rediscovering this ancient function in immune protection of vitamin D. And we also see with newly developed technologies that we have an abundance of vitamin D receptors on our blood vessels. So we know that there are other functions of vitamin D, and it's actually misnamed as vitamin. It's more similar to our hormones. So we call it pseudohormone. For example, so it's the only vitamin that can go into the nucleus and actually influence our DNA translation processes. So I would say the reference ranges need to be rethinked, and most of the cases, for example, in COVID-19 times, I had many patients that wanted to experiment with mega doses of vitamin D. And I really wanted them to be very safe about this. And I had patients who took 50,000 international units of vitamin D per day for months. And we checked the vitamin D levels regularly, and they never managed to cross the highest reference range. So it's still, they didn't manage to cross, and I think the reference range is still too low. So I would say we are at a high risk of being deficient in vitamin D, most of us, than being in the toxicity level. But of course, it's very simple to measure the vitamin D levels in the blood. So if you want to experiment with this, and we also know sometimes mega doses of vitamin D can help with certain autoimmune conditions. So being very careful, being very knowledgeable, being on top of the new developed research regarding vitamin D is the way to go. And of course, measuring and confirming with the blood tests.
Exactly. The key point is measuring and adjusting. We have another question from Marta. So what is your experience with glycanage in different anti-inflammatory conditions? Is the glycosylation pattern similar across different diseases, or is it rather disease type specific? For instance, rheumatoid versus lupus, for example.
Yes, so we do see certain differences, but in most of the, I would say rheumatoid arthritis and lupus, they are quite a little bit of different in their pathophysiology. So we do see some different patterns, but overall in most of the anti-inflammatory conditions, we see some sort of shift towards the pro-inflammatory side and a decrease of the anti-inflammatory protection. So we see this in, for example, inflammatory diseases of the gut, ulcerative colitis and Crohn's disease. We see it in rheumatoid arthritis. We see it in psoriasis as well. So there are very typical patterns that sometimes overlap. So for example, somebody that overlaps for rheumatoid arthritis in certain cases can also overlap for ulcerative colitis, and which is very interesting because I would say we need to shift a little bit towards thinking more preventatively. So we know that glyco patterns can be very specific, but also can be very systematic, indicating just a systematic pro-inflammatory shift. And perhaps thinking about these classical definitions of diseases in modern medicine is something that we will strive not to do in the preventative stage. We kind of want to focus more on the patterns that we are seeing, but we'll see how this develops. So far we see some of the overlaps in the inflammatory milieu of diseases. For lupus, we do see some very specific indications. I don't know if we have it actually in the new practitioners report. Sophia, do you know about, for example, how lupus differentiates from rheumatoid arthritis?
I do believe that for lupus, we're not even looking at the glycan indexes as you would see for other diseases. I believe that for lupus, we have specific glycan structures that we associate with the higher potential to develop lupus. But we will send you the sample report so you can take a look at what exactly goes into every disease. But I think it's a very good question. We do have another one, which I also love. So the question or the comment is, I have been taking glyconutritionals for 27 plus years with excellent health results. I understand that seniors should get more protein to preserve muscle. I am 81 years old and mostly vegan. Should I increase or decrease my protein intake?
Oh, amazing question. So yes, glyconutrients, I would say, are a very interesting area that I would really much like us to explore more. They were very popular, I would say 10, 15 years ago, but we didn't have such good technologies to follow the potential benefits of glyconutrients. So hopefully they will re-emerge again. This is I would say, a very controversial subject in the aging science today. I mentioned some of this before. So there are certain indications that actually protein restriction, particularly methionine restriction, which is rich in animal sources, can potentially influence our lifespan in a positive way. So I would say still we do not have any evidence that you going from mostly being vegan to increasing the protein intake would provide any additional benefits for you. Of course, muscle mass is also a very important parameter to preserve. And when we talk about reference ranges for proteins, I would say extra protein, so going above the 2 grams of protein per kilogram of body mass would not provide any additional health benefits for you based on the science so far. However, that doesn't mean that your protein intake should be extremely low. So you should target the range somewhere from being around 0.8 to 1.2 grams of protein per kilogram of body mass. And if you can, try to either restrict the methionine sources or boost the glycine sources, like I mentioned before. But I would say if you are mostly vegan, you are already doing that because vegan diet is naturally depleted of methionine sources and rich in glycine. But still, a very controversial subject.
All right, perfect. That was a very interesting question. We have another one, Kathy. So would a glycan age test benefit someone who is over 80 who has some chronic diseases?
Oh, glycan age testing? Sorry, I don't see that question.
So yeah, let me repeat it again. Would a glycan age test benefit someone who is over 80 who has some chronic diseases?
I don't know how to. Yes, of course. I would say definitely to see the impact of those chronic diseases on your aging process. So still 80, hopefully it will be considered as still like middle age soon in our future. So definitely we also have some clients that are over 80, and we recently did actually a documentary on, we measured the glycan age of super centenarians from Costa Rica blue zone. So they are all above 100 years old. And they all show quite beneficial results, most of them having 25 to 30 years lower biological age than their chronological. So definitely, and if you have some chronic conditions, it's even more useful for you, and you can still implement some preventative protocols even then.
Yeah, absolutely. So we have another question, and I think this is the last one we're going to take. So if a person just has an infection or for example, COVID or flu, how long should they wait to have the test? Is it 21 days or is it more?
I would say if this infection lasts for lower than a week, so for example, 4 to 5 days, we wouldn't see any drastic influences on your glyco profile. So you can take your test even days after the infection. It typically, I talked about, for example, shoulder injuries. So those are last a lot longer, the whole recovery process, and if the surgery is involved as well, so they last longer than 21 days. So in those injuries, we would see influences on the glyco profile. However, with infections, with seasonal flu, we do not see any drastic changes in the glyco profile. So you're safe to take the test. What I also want to mention is that we do see certain specific cases where we have prolonged COVID-19 syndrome, and in that cases, we do see negative influences of that virus on the results. But it's also important to know if that occurred in your case, and if it's combined with prolonged COVID-19 symptoms, it could be a powerful measurement for you to put your focus on this and try to recover as fast as possible.
Absolutely. Okay, one last question, and we are really done with this session because it's already 7 and we don't want to keep you any longer, but I think this is a good one. So if a robust immune system is associated with glycan age reduction, and most modern drugs used to treat inflammatory diseases are designed to suppress the immune system, how can we calm immune response while increasing immune function?
I'm not really sure that I fully understand this question. Dalia, I think you asked about the corticosteroids, and if you want, we can have a conversation session after this, because I do have some additional information about particularly chronic diseases and how they're associated with chronic inflammatory diseases of the skin and of the gut, and how they influence the glycan age results. I need to read this again in order to understand. Sophia, do you have a potential answer ready?
I think it's a very good question, and essentially what we want to do even when we discuss the results with our clients, we never want to say we want to have as many anti-inflammatory as possible and then just remove all of the pro-inflammatory glycans. We want this to be in a balance, because both responses are important. And when we talk about inflammation, inflammation in itself is designed to keep us safe, right? So we want to still be able to trigger acute inflammation so we can fight off bacteria or anything else that's attacking us. On the other hand, we don't want our immune system to be overstimulated, because it will start attacking other parts of our body. This is what autoimmunity is. So I'll let Paula read this question, and we can get back to you in an email. We're really
but I just wanted to say just a few last words. So I think I got it now. So for example, imagine a person has psoriasis, and they would have, if this is untreated and if they measure in a state of a flare-up, what we would see is potentially, in most of the cases, we do see a systematic pro-inflammatory shift. So we would see increases of the glycan mature at the same time when we see decreases of the glycan ute and glycan shield, so anti-inflammatory glycans. So in this situation, for example, an anti-inflammatory medication is influenced and the person is a good responder, so the flare-up reduces. Well, what we actually see in the glycan age results is an increase of the glycan shield in youth and decrease of the glycan mature, resulting in an overall lower biological age. So it can be quite confusing, but we are actually, with this anti-inflammatory therapy, we are actually making our immune system more robust with increases in the glycan shield. Hopefully this answered your question. So these inflammatory diseases are one of my passions that I have, and I really want us to find direct measurements to see, to evaluate, to predict potential flare-ups in these diseases. And I believe that glycan age can get us there. More research is needed. But yeah, it can be complicated. But for example, if you have a patient like that, if you measure it before and after implementing a protocol and see the glycan details, it will become a much clearer picture.
Perfect. I think that sums it up. We're 4 minutes over. Thank you all for staying with us and for asking the questions. If you do have anything else, if you think of anything else, feel free to reach out to us to partners@glycanage.com or our individual emails, which is paula@glycanage.com or sophia@glycanage.com. And we will see you in the next one. Have a great evening or day, wherever you are. Thank you. Bye-bye.
Thank you. Bye.